Hey Bobcats fans, it's Sean Clement back here at our favorite place downtown Danville, Athletico. I'm here with somebody new today. Go ahead and tell the people about yourself.
Hi everyone, my name is Heather Harbor. I'm a physical therapist and the regional director with Athletico in Central Illinois. I've been with Athletico going on 10 years. I've been a PT for 12 years now. And really excited to work with the Bobcats and working with the Danville Clinic to develop this partnership and help support you guys.
Well, we are thrilled to have you guys aboard and obviously thrilled to have you here today. It's a new segment called Wellness Wednesday. We've been doing it for a couple weeks now. Heather, obviously the effect of the cold, long winter months is tedious on everybody. The snow's been falling. Everybody's dealing with things a little bit differently. And one of the big things I know I get are the bad headaches from being inside so long. Is that something PT can help us out with a little bit?
Absolutely. It's not uncommon that we'll hear someone that they're coming in for physical therapy and mentioning headaches and have no idea that PT can help. I know we did a previous segment talking about ergonomics and setup from home. One of the most common causes we see of headaches and neck pain is actually related to posture and how people are sitting and how they're moving throughout the day.
Huh. And how does posture affect that? I mean, obviously, I've heard about backaches and things like that. People bent over when they're older. I hadn't really thought about it as far as headaches go.
Yeah, so if you're sitting and you're starting to slouch forward, you think about computers pull us forward or phones pull us forward. How often in your day are you sitting slouching and looking down for different reasons? The changes in that posture will put different pulls on the muscle and put your head in a different position. It can cause a lot of tightness through the muscles in the very back of the head and tightness in the muscles here that come up. Those muscles, when they're really tight and develop trigger points, can actually cause headaches from the back of the head and wrapping all the way around to the front portion of the head.
Now that's something where, especially if you're on a job that uses the phone a lot, where that might be something you're doing quite a bit. I know me personally, I live like this, so that's something that I want to take advantage of and be aware of.
Yeah, absolutely. So your posture when you're on the phone, trying to make sure you're not tipping your head sideways all the time. But there are also some different exercises and stretches that can be done. I'll talk about those in just a little bit. But one of the things that we do with physical therapy is we also do hands-on techniques to address tightness, whether it's a joint restriction that's contributing to the pain, or you think about that knot right here that you get when you're on the phone for a long time. There are manual therapy techniques that we can use that will help to decrease that tightness, to decrease your pain.
Okay, so physical therapy is really more for everyone, more than just athletes. I know our guys go through a lot of PT over the course of a season, but obviously it's for the people at home too as well, right?
Absolutely. So we see everyone from kids through mid 90s, everything in between. Because just because you're dealing with a pain, one of the things we hate to hear is I have to deal with this pain because I'm just getting older, or because of my body, or because of my job. I have to have this pain. And there's so many things that we can do within physical therapy to help relieve that pain.
What kind of things can people do at home on their own? Obviously, if they're just trying to get rid of the pain immediately, obviously we know they can come down here and see you guys. But if they're full, like some of us are with busy days and have some trouble finding time, is there things they can do on their own before they make that call and come on in?
Absolutely. So I know Jenny mentioned in one of the previous segments talking about taking that break. 5 minutes out of every 30 minutes. I've had patients that have set timers or reminders on their calendar. I had another patient once that actually got an hourglass, and when he noticed that the sand was out, that his reminder to stand up and walk around. Getting up and walking around every 30 minutes can make a big difference because you're getting out of that forward posture. Another thing you can do, and I know Jenny alluded to it earlier, is standing, either sitting or standing, working on pinching your shoulder blades back to help open up your chest and engage the muscles in between your shoulder blades. That can help take some of the tension off of the muscles in the neck. You can also do a chin tuck, or we call it chin retraction, where you're standing or sitting and trying to bring your chin back, almost like you're trying to give yourself a double chin. No one can see you when you're in the mask.
If you have that naturally, does it take away the second chin? Because I'm all for that.
It won't take it away, but it'll give a nice little stretch. It'll make you feel better.
Okay.
So doing that chin pull back can give a little bit of a stretch to the muscles at the top of the neck.
Okay.
You can also do a stretch where you're standing and just tipping your ear down to your shoulder to get a stretch on the opposite side here. Another one you can do if you're sitting or standing and just doing a gentle trunk rotation. So you can do that rotation side to side, holding for about 5 seconds. You can also do a tip sideways and doing a reach overhead.
Okay.
So it's important to know that there's not a one size fits all. So if you're having pain and you try to do stretches and it still bothers you, or if it causes an increase in pain, don't continue to push through it. That's when you want to check in with us. If these are relieving and helpful, that's awesome. That's why we're here. But if you're having symptoms that are persistent, give us a call. We do offer free assessments. It's a 30-minute consultation with one of us here at the clinic where we'll take a look, see what's going on, and we'll be able to make recommendations, whether it's a simple stretch or something that you would benefit from physical therapy.
And talking about that, obviously, you guys are all medically trained and working here professionally. That's something that somebody's coming in to see you for free, not having to work with the insurance and everything else until after that initial consultation. So that's something people can be taking advantage of right here at the downtown Danville location.
Absolutely. Now, if you know that you're having pain, you want to start physical therapy, Illinois is also a state that doesn't require a prescription from your doctor.
Oh, wow.
If you know you want to come to physical therapy, you can call us. We'll verify your insurance. We get your insurance information. We verify that ahead of time. But you can come straight to us for physical therapy without having to do that doctor visit and then coming in.
Wow. So you're saving time and money. I love that, folks. Can't beat that with a stick, eh? As we head back towards David S. Palmer Arena hockey time. Obviously, I want to thank our great friends here at Athletico. Heather, thanks so much for taking time out of your day today. And again, look forward to seeing everybody at the rink this weekend. The Bobcats back at home. Thank you so much, and go Bobcats.
Go Bobcats.